One of the problems I faced as co-owner as well as CEO of Howard's is finding trustworthy employees. It's so hard as a leader to find and operate a business that runs smoothly with a team that consistently delivers excellence. And that's kind of what the Offsite Team has allowed us to do. And people are really surprised. You mean you have team members in the Philippines? Yeah, we have actually 32 or 33 or whatever the number is. One of the biggest problems is dealing with prior authorizations.
Each insurance, we have a portal login that we can use and submit the prior authorization easily. It just takes a minute, just as long as we have all the documents that we need.
We get frustrated, customers get frustrated. It takes up so much time. It's a pain in the rear end. Something that used to be as simple as here's a prescription, here's your new CPAP mask. Let's talk about new CPAP setups. So typically what happens with a new CPAP setup? How does that work? Here, well over 10 years, but I also have other customer service reps or other people, I swear it takes us 3 months to hire someone. We train them and then they might leave at 6 months or even 2 years or 3 years. I was going back and looking at all the Offsite team members. We only have 4 team members. I think it's 4 actually leave us in 4+ years. So no wonder why we're doing so well as a company is once we train, they stay with us. We use the term fax wrangler. We actually have a number of fax wranglers every single day as they wrangle faxes. We don't have to deal with that anymore in terms of staying late. So typically, you've been here. The store closes at 6, we counted the till, and frequently, unless there's a customer in the store, our CSRs can leave at 6:10, 6:15, and we're done for the night. Because we have Offsite Team fax wranglers, it has really, really freed us up. Now, your husband also works for Offsite Team, and he has previously been a fax wrangler. So tell me a little bit about the process. How do we wrangle faxes? What are some common problems that our rehab team encounters on a day-to-day basis?
I've seen that before when we don't have the Offsite Team, or way back when I was starting, there's a lot of paperwork that needs to be done. So we have rehab team members that are in the United States, but right at the same time, they have to talk to the patients, like the one that goes in stores. Having the Offsite Team, it's one of those problems that we have solved because we can do the administrative tasks while the on-site team attends to the customer's need that goes into the store.
Absolutely. Now, one of the things that absolutely baffled me was a lot of our competitors in our region almost stopped doing manual wheelchairs completely. They just basically said too much work. It is covered by insurances, but the insurance paperwork for wheelchairs is so doggone hard, we're not going to deal with it because it takes too much time. What we did is we figured out why are not more providers utilizing rehab. And when I say rehab, for those people who are not in the rehab business, essentially you have a standard K1, 2, 3, 4 wheelchair. The moment you change something on it, put a different back, it turns into what's called a rehab wheelchair. How is the Philippines different from the United States? And I know that seems a little weird because, you've only been here once, but compare the Philippines to the United States. What's the difference between the two countries?
The weather, because it's a tropical country in the Philippines, so we don't have the snows and all that. Fall, we only have summer and then the rainy season. It's always hot and humid all around the year. But other than that, I would say, coming from the slogan of our country, it's more fun in the Philippines.
But I can totally see why. There's something called the 13th month pay. What is the 13th month pay?
The 13th month pay is a labor law in the Philippines. It's one of the proclamations from one of the presidents back then. It states that the employer has to provide a compensation of 13th month pay, which is equivalent to at least 1/12 of the annual basic wage.
This is I had never heard of such a thing. In the United States, we would just call that a Christmas bonus. One of the common complaints, you're going to have a call center in the Philippines. That's just horrible. I've been yelled at a few times. Here's my counter argument. Would you rather talk to someone who English is not their first language and sit on hold for 45 minutes? Or would you rather talk to someone where English is their second language, pretty doggone good, and you get answered immediately? What would be your choice? You can figure it out. And so the way we've set things up in our business is you have Offsite team members, and it's not like we only have Offsite team. We use a hybrid approach, both team members that speak English across our 5 locations, and we have an Offsite Offsite Team. And so it's a both and, because sometimes there are questions you do not know the answer. And so you'll call to one of our stores and say, hey, I don't understand what this one person's saying because they're using some really complex medical terminology that I haven't figured out yet. Or what's the status of this order? Is it pulled? Is it shipped? So we use this combination hybrid approach, and it tends to work pretty well. The Philippines has a high English literacy rate, one of the official languages of the country. I was fascinated that even your court cases, if you ever have to go to court in the Philippines, it's in English and not Tagalog, right?
Yes, correct.
And you learn from a really young age. And another interesting thing, your accent is slightly neutral, a little more Americanized compared to other accents around the world, which is really helpful. I'm going to dive into the hard issues. HR. No one likes HR. I personally despise HR because it's like, can't we just take care of our customers and work and not deal with HR is a pain in the rear end? But all companies need to do HR. We have US-based employees, we have Philippine-based employees, and we work together in one cohesive team. So what I like to tell people when we interview people, everyone always wants to know, okay, one, am I going to get the job? But two, how much money am I going to get paid? And that tends to be the big thing. And that is wrong, because really, once you get a job, the most important part of that job is what I would call your KRA, your key results areas. Now, why is that the most important thing?
Medical documentation is one of the KRAs of our Offsite Team members. There's also this communications wherein they need to update the customers with the status of the order. We have to call the patients.
Why are KPIs important, April?
Well, KPI is key performance indicator, is the metric that we use. So it has to be specific, which is why it's very important. It needs to be measurable, relevant to our goals. It should be time-bound, actionable, and accurate. So it also helps us. The reason why it's important for me is because it's helped us inform decisions and drive performance improvement. So let's say if one of the team members are not having a good KPI, then what we do is we look for training opportunities.
Were you here at Howard's before we started doing KPIs?
Yes.
Okay. Did everyone love it? So when I, by the way, this was hard to get these instituted. I worked with our executive. Hey, we need to do this. We need to do this. We need to do this. I have some bad news for everyone. If your company does not have KPIs and you lead this charge, are things going to get easier or better, harder or easier from the get-go?
It's actually both. So it got worse and then it got better.
Yeah, for my life, it got worse. The number of people who threw a fit and walked into my office, you don't trust me, this doesn't happen, I'm like, well, you're not doing your job. This is not the message. Hey, if you institute KPIs in your company, immediately things are going to get worse for you. I'll just tell you, your performance actually might get better immediately. Actually, I would say your business performance will immediately get better. You will make more money, but your personal life at work is going to get harder because people are going to say, you don't trust me. You don't understand how hard this is. I mean, you name it. It's going to get harder. So what are some of the downsides that you found from using AI as you lead the Offsite team, even as you talk to different team members?
Oh, well, sometimes it gives inaccurate information. So when I ask for something, how do you say this? And then it's going to give you inaccurate information, which is not good. You really have to read through the lines. You don't just copy and paste. I'd say you have to be careful when using the AI, but I'd say this is very helpful, especially for us Offsite, because if we have to create a cover letter or an email to send out to the team, it's helpful because there is this path that you can take, but it does not necessarily have to be copy and pasted, but it just gives you the idea or insights.
Or you say, hey, I'm driving from this store to this store. What are 3 options of a path that I might want to take? When I say the word audit, what do you think about it, April?
It's like a detective checking in your work.
Yeah, it's just like, Magna PI or Columbo or, think of the detective, and that's kind of really what an audit is. And so what we're going to do today on this podcast is we're going to demystify the concepts of audits. We're going to dissect their components, unveil the strategies that can turn them into stepping stone towards unparalleled quality and service in the respiratory DME rehab care domain. I once had an audit. It was Medicare. It covered 10 power wheelchairs that I had dispensed. I had all what I thought. I had all of the appropriate documentation for these 10 power wheelchairs. And they audited. They're like, give me everything, because this is what it says that you have, A to Z, everything. So I'm like, okay, I can do this. I had never had a major audit like this. I'd had one here, one there, but they asked for 10. So I had these massive files, and you know what? On those files, I was missing like 1 or 2 items. And I was like, oh crap, I'm missing 1 or 2 items. I need to go see if the doctor can fix it for me. And I did it, and I sent it in, and it got denied, and they sent it back to us, and then we kept raising it all the way up to ALJ. And it kept getting pushed out and pushed out. They recouped the money on it. In the end, you know what? I kind of got distracted, and I stopped appealing the claims, and I never did get paid on those 10 wheelchairs. And this is when wheelchairs were reimbursing your KO823 close to $5,000. So our business lost between $35,000 to $50,000 because my paperwork was not squeaky clean. It was the most expensive continuing education I've really ever done. I mean, think of going off to college and get a master's degree for $20,000 or $30,000, and here I spent $50,000, and I learned a whole lot about audits and what that looks like. You have worked in a BPO, Filipino call centers. What was it like when you had to go into a call center?
I'd say it's good in terms of training because it's easy to get the things that you need in terms of training. If you need something, it's readily accessible. However, the thing that I hate about going to work is that, the traffic. You've been here.
Oh yeah, it's horrible.
Yes.
So when you get to work from home, not only do you have to not pay to get to work, you get 4 hours of your day back. And with you,
correct,
that's 4 hours you get with your husband. That's 4 hours you get for self-care. It's 4 hours you get to spend with your son, taking him to school or helping him with his homework. We get to give you all of that because you work from home.
Exactly.
We might just want to stop the podcast right now, but actually we have 10 reasons. The importance of insurance provider relations is vitally important. This would be like stakeholder agreement. So what we're doing is we're building solid provider relations and ensures that all stakeholders, this would be like the DME, the respiratory company, but also the insurance side, the healthcare providers, and the patients. So it makes sure that we're all on the same page. So take a really complex piece, such as like a ventilator or a Group 3 wheelchair. Those are really hard to get covered, but they're actually really easy as long as you know the rules. We have done so many of those. It's really simple. Like, it's not that hard to get a Group 3 wheelchair. You need to get a prescription, but then you have to have a PT/OT evaluation that has to get signed off. You have to have the quote. We know exactly what it is, but it works because there is stakeholder alignment. We know exactly what is required. What should providers know about the 36-month mark in regards to home oxygen?
For 36 months onwards, we need to make sure that we're still doing the maintenance and services.
In order to bill for the oxygen contents, what do you have to have in a patient file? Or in the file typically? Let's go off Medicare criteria.
Right. Well, basically, we need to make sure that we have a delivery ticket on record. That's the number one requirement. We cannot bill both the concentrator. We can only bill the contents after the 36 months mark.
I'm going to act dumb. Is the original prescription good, or do we need to get a new prescription every single year?
We need to make sure that we have a recertification for the prescription. So we have the so-called revised, and we also have another thing that's called recert. So every after a year, once the prescription is no longer valid, we request for recertification from the physician who ordered the oxygen for the patient.
Most wheelchairs need what's called a home assessment. Medicare says, in order to have a wheelchair in the home, you have to basically say, make sure it works in the home. Now, when doing an assessment, can this be done virtually? Can you do it over the phone, or do we need to actually go out to everyone's house to do these wheelchair assessments?
So we actually go to the patient's house to do an assessment. That's the number one. However, as I have read, we can definitely do it virtually too. So we can do it virtually, but at the same time, we need to make sure that we are also checking in with the patient once we deliver the hospital bed. The wheelchair. I'm so sorry.
Well, hey, we're going to do a wheelchair and a hospital bed. No, but you're right. In-home assessments for wheelchairs can be done either virtually or remote. We work with Offsite Team members, which in other words is virtual Filipino workers. But what's interesting, I understand people listening to this podcast think, we're going to be hiring someone from the Philippines. They're all the same, aren't they? Like April, everyone on the team is the exact same, right? As I say that with all sarcasm.
No, everyone is not the same.
Everyone's different. So what do? How do we figure out who the right person is for the right job, April? What are we going to do? It could be a problem.
Definitely, which is why we do have the personality tests for everyone. So everyone has to go through it. We want to make sure
Yes,
that we know.
we test all of our team members because everyone's different. Everyone has a different personality. So this is my favorite time of the year because a lot of times people are coming into Howard's, which is the home medical supply that we oversee with the Offsite team. And I love it because they'll come in to get a CPAP machine, ostomy supplies, wheelchairs, home oxygen. And we love it because we verify insurance and they might say, hey, Mrs. Smith has a $500 deductible or even a $2,000 deductible, but she's already hit her out-of-pocket max. So we love this. We don't have to collect copays at the time of service because she's hit her out-of-pocket max. So how easy is it for you and the rest of the Offsite team to close these sales when we've hit the out-of-pocket max?
It's actually very good when we see that when we run eligibility, especially the out-of-pocket maximum, because when the customers met their out-of-pocket maximum, it means that they're not responsible for anything. The insurance will cover pretty much 100% at that time.
It's great, absolutely. And so they're coming into our store because they need oxygen or they need a CPAP machine. So they're coming because they need something. And then not only that, do you get to give them what they need? We don't have to charge them. They've hit their out-of-pocket max, which is just amazing. So now tell me a little bit. Employees in the Philippines, does employers typically invest into employees? Is that something that commonly happens or is it really rare?
I would say at first because they invest in training because it has to be there. But the thing that's lacking is as compared to our team is that after the training, once you're already working, the training that we do, like the leadership training, it's very important, which we don't see in other companies. I think that's one of those that I have not experienced before, which I'm really proud of because not only it grows you as an individual, it not just benefit your work, but also your personal life, which is very important.
One, we work with the Offsite team members. We make sure they jive with our company's mission and vision. So the very first thing we do before we release any Offsite team members to work with other companies, when we talk to, let's say, if you're calling our company saying, hey, I need one fax wrangler or I need one inside salesperson, we are going to ask you, what is your company's mission? And the reason why we need to know your company's mission is we're then going to take an Offsite team member and try to get the right team member that complements your company's mission. We have this bizarre thing called deductibles, and I was just looking at I'm in Washington State, the Washington State Healthcare Exchange. I was looking at insurance for my family of 4. This year, for a high deductible plan, we're looking at it's about $13,000 just to buy coverage with an $8,000 deductible. I was telling my wife, so you're telling me I need to spend $20,000 before I get any services? And this was that one insurance company that we are not going with, but deductibles are crazy. So if I walked in to your home medical supply store and said, hey, I need a CPAP machine or I need oxygen, do you have health insurance? I could say, yeah, I do. But with an $8,000 deductible, it's almost like, what's the point when it's not going to be covered until I spend $8,000, which is ridiculous.
Exactly. So what we do is we offer them private pay. You can private pay the durable medical equipment that you need. You can also change the payment.
What we would say is cash is king. So hey, April, when we talk about a new year and new insurance policies, what do you think about?
Well, first and foremost, deductible.
Absolutely. Deductibles always go up every single year.
And then new policies apply.
And so, a lot of, let's just start with easy Medi plan. Or, a lot of people will have Medicare and then like a supplemental, like an AARP or a plan like that. And typically, some of these plans will cover deductibles and some will not. What gets really crazy is, let's say last year, the secondary did cover the deductible, but this year they don't. That has happened a number of times over the years. So what do we do in those instances?
We run eligibility. So Offsite team knows how to run eligibility. Plus, they know how to educate the patient or the customer in terms of their policy. So I think that's very important when the Offsite team knows what they're doing because they can present it properly and they would understand what it means, like changing the insurance. That previously this happened and right now this is happening.
And one of the things, we just don't say, hey, the Offsite team is going to call your patients and say, hey, we need your money because you have a deductible. We train our team, and this is whether you use us or not. We train our team. We're going to call with empathy and say, hey, April, I need to let you know unfortunately, your deductible is not covered by your secondary insurance this year. Offsite team member, we take really good care of our employees. So tell me about the culture differences amongst the Philippines versus the United States and parents and kids. What does that look like, April?
Well, first I'll start with we are family oriented. A lot of Filipinos, even after marriage, they tend to stay with the parents. We have a close-knit relationship when it comes to our parents. So even the siblings, it's just the boundaries, I think, would be the number one problem. But you know, the word that we always say, there's not enough money left to save, but perhaps it's not really the fun that is lacking, but it's a discipline.
Absolutely. Discipline is freedom.